Hello, my name's Geraint Lewis. I'm a Senior Fellow at the Nuffield Trust, and I'm going to give you a quick taster about a summit that was held on the 14th of January 2010, looking at the use of predictive risk modelling across the 4 nations of the United Kingdom. In the morning, we heard from representatives of all 4 nations of the UK and how predictive modelling is being used in those countries. And then the afternoon was an opportunity to hear about some new research projects that are currently underway and to hear from some people at the clinical front line in how they are actually using predictive models in practice. I think it's important to note that predictive modelling and case finding are just one aspect of how risk adjustment can be used. The other principal uses of risk adjustment being resource allocation, evaluation and performance management. In the United Kingdom, the main use of predictive modelling has been for case finding purposes. In other words, for identifying people who are at high predictive risk of an emergency hospital admission in the coming 12 months. And all 4 nations of the UK are currently using risk adjustment for this purpose. So in Scotland, there's a predictive tool called SPARRA. In Wales, there's a model called PRISM. In England, we use something called PARR and the combined model. And then in Northern Ireland, there are plans to develop a specific model for the province, but at the moment, they are currently using the PARR model from England. And later on in this presentation, I'll be telling you a little bit more about each of those models. As it happens, the Department of Health actually launched a resource allocation formula on the same date that the conference was held. This is known as the Person-Based Resource Allocation Formula, PBRA, and it was developed by analysts at the Nuffield Trust and a number of universities. And this will in future be used for setting the income for GP practices across England. Another use of risk adjustment is for performance management. So for example, where regulators such as the Care Quality Commission in England or the Quality Improvement Scotland are analysing the performance of different hospitals, it's very important that they adjust for the types of patients seen by those hospitals, and this is where risk adjustment can help ensure a level playing field. The Nuffield Trust is currently evaluating a number of complex preventive interventions across England and are using risk adjustments in the evaluation to make sure that our findings are fair and accurate. The first country to present at the conference was Scotland, where we heard about the SPARRA tool. This stands for Scottish Patients at Risk of Readmission and Admission, and it's a mathematical formula that's applied to routine data, and predictions are made available to people across Scotland, to GPs and to senior nurses, so that they can identify which patients are at risk of an emergency hospital admission and therefore can be used to target preventative care to these high-risk patients. In England, the analogous model to SPARRA is called the PARR model, and Natasha Curry from the King's Fund presented the most recent software version for PARR, which is known as PARR++. And this slide shows you how that looks to frontline clinicians where they use the software for identifying high-risk patients. Marina Lupari from Northern Ireland then spoke about how the PARR tool is being used in Northern Ireland to identify high-risk patients. Marina described a research project that she's been conducting. This is using a non-randomised research method, but is comparing 2 areas of Northern Ireland, one where patients are receiving usual care and the other one where they're receiving targeted preventive care based on the PARR model. We then heard from Leo Lewis and Dr. Gareth John from Wales about the Welsh Predictive Risk Service. This is quite an exciting new development. They are using an algorithm that's similar to the combined model in England. It's called the PRISM model. But the key difference is that it's being made available to clinicians across Wales using a secure website on the NHS internal network, the N3 network. We began the afternoon with a presentation from Rona Guild from NHS Angus, telling us how she and her colleagues have been using the SPARRA tool in that part of Scotland. One of the ways in which the SPARRA tool is used in Angus is for identifying patients for the COPD Anticipatory Care project. This is a well-established project, but the SPARRA tool means that it can now be targeted more accurately at patients who are truly at risk of future emergency hospital admissions. We then heard from some researchers at the Nuffield Trust about quite an exciting project being conducted for the Department of Health that seeks to use predictive risk modelling for predicting social care use and not just health service use. Although it might have been a slightly dry topic, it's really important to consider what the legal framework and the ethical framework is for doing a lot of this work. So Adam Steventon set out what the law is in England and how we make sure that we comply with the highest ethical standards and information governance standards. This slide shows you, for one individual, what all of their health and social care contacts looked like over a 3-year period. So the small crosses across the bottom of the chart each represent a visit to the GP practice. The triangles all relate to secondary care use, so you can see that the green triangles, there are 3 of those and they're each an outpatient appointment. The red triangles are A&E visits, and most of those are followed by admission and discharge to hospital. The orange circles are social care assessments, and then the red circles are packages of social care. So we can see that this individual visited their GP multiple times over the course of the 3-year period. They were admitted repeatedly to hospital, and then the important thing to look at is in the top right-hand corner, that bright red bar represents an admission to a nursing home. So this project was really trying to use the information in routine data to predict that outcome in the top right-hand corner. This table describes some research that I myself carried out in the United States a couple of years ago, looking at something called impactability models. Impactability models can be thought of in the context of a whisky distillery. If you think about the population as a whole, the purpose of the predictive risk model is to distill that down to a list of people who are at high risk of emergency hospital admission in the coming 12 months. This chart shows how predictive risk modelling has been used to evaluate complex interventions in England. We're able to track the health service use of participants in some of these interventions and then construct a very closely matched cohort of patients, a control group, so that we can test out whether any changes in hospital use are due to the intervention or whether actually they would have occurred anyway. Going to the other extreme of the country now, Helen Linden from NHS Cornwall and the Isles of Scilly described how she and her team have been using the PARR tool to identify which patients should receive the support of a community matron or telehealth and telecare devices. Last but not least, we heard from Professor John Billings from New York University, who built the PARR model, and he was telling us about how he uses analogous models in New York State. Professor Billings uses predictive risk modelling on a very vulnerable cohort of patients that receive Medicaid funding in the city of New York. And this slide just describes some of the characteristics of those patients, highlighting the fact that many of these people don't have a social support network. And the reason this is important is that if we're thinking of offering care to these people, we need to think not only about their health needs, but also about their wider social care needs as well. All of the presentations from the summit are now available on the Nuffield Trust website, www.nuffieldtrust.org.uk. We're hoping to run another summit in the near future, hopefully bringing in some speakers from continental Europe and the United States, as well as the home nations of the UK. If you'd be interested in attending this summit, or if you've got any other ideas about what we should include in future summits, do please get in touch with us through the events team at the Nuffield Trust. The email address is events@nuffieldtrust.org.uk.